Welcome to Health Center at SUNY Downstate, where your health is our priority. My name is Anika Daniels-Osaze, and I'm your host for today. And our show actually features a conference that was sponsored here at SUNY Downstate in collaboration with the Brooklyn Health Disparities Center, the Arthur Ashe Institute for Urban Health, and the Office of the Brooklyn Borough President. Today's conference theme is Interdisciplinary Dialogues on Patient Adherence. We have Dr. Torian Easterling, who is Brooklyn's Assistant Commissioner for the New York City Department of Health and Mental Hygiene. And we also have Deputy Borough President Diana Reyna.
Good afternoon, everyone. Such a pleasure to be here. I would just want to commend Dr. Sally Fu, Dr. Straker, the Brooklyn Health Disparities Center on yet another fine symposium and seminar on such a critical issue around adherence to medication and patient adherence. As was already mentioned, my name is Dr. Torian Easterling, and I do serve as the Assistant Commissioner, but for Brooklyn, for the Department of Health. The connection is quite clear, because when we think about adherence to medication, patient adherence, when we think about who needs to be activated around this issue, is not just healthcare systems, not just physicians, not just healthcare providers, but we're also thinking about pharmacists, faith-based organizations, community-based organizations, barbershops, beauty salons. There are people in our community who have the ear of their residents, of their neighbors, and we all need to think about what is the alignment and how can we make those connectivities. For Commissioner Bassett, this is something that she's been really truly raising the alarm around. How do we add sort of a health equity lens to all of our work? And so when I look around this room and I see there are students, there are healthcare providers, there are leaders around health and other social issues, we understand that this issue is not just a health-related issue, right? There are social and economic implications that we have to take into account. And as we heard from earlier, as some of our patients have raised, is that there are some economic issues that physicians have to have conversations about, right? There are critical decisions that individuals are making about whether or not to purchase their medication, pay their rent, put on their lights, pay their child's school fees. I mean, there are things that we have to consider when we're talking to individuals within our community. And so one quick fact, and I chose not to do slides and chose not to do a whole presentation, but one of the things that we highlight, particularly in Brooklyn, so Brooklyn has the highest rate of premature mortality than all the 5 boroughs, right? And so when we think about the number of people who die before the age of 65, Brooklyn has the highest rate. We don't have to get into numbers, just understand that that is the fact and that is the truth. You can absolutely go onto our website and you can see those statistics. But if we underline the number of people who are dying before the age of 65, and then if we talk about, well, there could be health behaviors, there could be genetic related, but we understand that there are other social factors, and this is where we talk about health inequities that we have to consider, right? And so when we talk about the root causes of health inequities, yes, we can talk about health behaviors, but then in that same conversation, we have to layer it with gender discrimination, systemic racism, structural racism that exists within our institutions, right? And so when we have to call out medical mistrust that we hear quite often from our patients, right? And the gentleman spoke about the resistance among men to even engage health providers. There is a reason, right? And we have to uncover and unpack that. And if we are not willing to be bold enough to have those conversations, then we're going to continue to have this symposium for decades on end, right? And so it's great that when I looked at the agenda and I saw that we weren't just talking about the issue from a medical perspective, that we were also engaging it from a social determinants of health. And so I'm happy to bring this quick and short message from the Department of Health, where we've just established a Center for Health Equity. We wanted to really amplify the health department's mission to address the root causes of inequities. And that includes structural racism, discrimination, and particularly naming racism by its term, right? And so there are things that we're doing. Yes, We're investing in key neighborhoods. So in Brooklyn, we work in Crown Heights and Bed-Stuy. We work in Brownsville and East New York, in Manhattan, Central and East Harlem, and in the South Bronx. Many know Claremont, Bathgate, Morrisania. Because when we look at the epidemiology, we can see that in all of these neighborhoods, it's quite the same. Whether we look at voter turnout, 311 calls, we layer that on with asthma hospitalizations, we layer that on with poverty, with violence, the indicators are all the same in all of these neighborhoods. And so if we're only going to have a conversation about health behavior, then we are totally missing the boat. And so we have to have a full conversation, a comprehensive, about the social factors that really lead to the health outcomes that we're seeing in these neighborhoods. And so I'm glad that it's happening here. Again, I commend the leadership at the Brooklyn Health Disparities Center and all the different community partners who are here. And I'm going to take my seat and continue to listen to the speakers. So thank you very much.
I would like to take now the opportunity to introduce to you Deputy Brooklyn Borough President Diana Reyna, and she has been in the community for many years. I'm sure she'll share some of that, but she comes to the stage now to speak a little bit about Brooklyn Health Disparities Center.
I come to you as the Deputy Brooklyn Borough President, but also as a patient in Brooklyn. And we must not ever forget how we need these briefings, this type of connection to what can easily be forgotten or glossed over. That sense of reality, the day-to-day in New York City. It's a fast-paced urban environment, and that alone can create the chaos that Dr. Foster was mentioning, right? The issue of have I taken medication if I'm running late for work and I'm late to take the kids and I'm late, to make that first conference call in the morning, and I haven't looked at my calendar to understand where I'm going, and I still have to make sure that my parents took their medication and they're up and about, that my dad doesn't fall because he suffered a stroke. Just giving you a little sense of what I'm dealing with. The candle's burning on both sides of the stick. Once a man, twice a child. And that sense of, can we juggle it all? We have to pause, and we have to really start thinking about what is the patient going through? What is the patient actually understanding of what it is to adhere to medical expectations, to continue a sense of lifestyle that won't demoralize. My name is Diana Reyna, and I'm the Deputy Brooklyn Borough President. On behalf of Eric Adams, we just wanted to thank what is this institution, SUNY Downstate's Brooklyn Health Disparities Center, one of great value. And, as I was listening to the presentation, I was just telling myself, how great would it be to just take this presentation into the classroom for every child to listen to, breaking down information and expecting an adult to understand it when it's just being presented to them for the first time because they're ill is not a great way to deal with health. And if you age down a presentation like this, I think it goes a longer way to creating a culture, a shift, a mindset shift, a culture shift around better health care and what that really means to the individual. And when you talk to a child and how that child brings it back to the home, and then we're catching the family at the top and at the bottom, there's no way they can escape. And so I wanted to just share that. And if there's an opportunity for us to work with the Disparity Center to take this presentation, every child has to have some type of health course. A 30-minute presentation like this can do wonders for a child. When they understand their body and their environment, the human development, and what it takes to take care of the mind, body, and soul, then you reduce the chaos or you learn to manage chaos and chaos won't manage you. So you have power and control over your health. I'd like to thank Dr. Moros Salifu, Director of the Brooklyn Health Disparities Center, Dr. Marilyn Frazier, Director for the Brooklyn Health Disparities Center, Executive Committee at the center, and to our Sandra Chapman, who has constantly been a champion in Brooklyn Borough Hall, Dr. Michael Lucchesi, and to all the staff and volunteers that just make the Disparity Center what it is today, for us to have a better sense of where Brooklyn is at. It's that gauging the needle, where are we, has to always be a constant reminder, a constant question we're asking ourselves. We represent 2.6 million people in Brooklyn. 47% of all Brooklynites speak a language other than English in their household. That's a lot of global cultural competency. When you start thinking about the volume of languages, and does that represent what our medical professionals across all fields, you start understanding that the formula does not equate to a very good outcome if we can't communicate, and that's the first barrier. And then you add to that what is our cultural difference and trying to connect. How do you then develop the trust, the patient-doctor relationship, the patient-nurse relationship, the patient-psychotherapy relationship? I continuously, throughout the presentation, kept thinking of my dad. Recently, I had to take him to a cardiologist visit, and the cardiologist visit was very interesting because it's the first time I'm speaking to the cardiologist who last year had tested my dad for his carotid arteries, and there was a 30% blockage, and lo and behold, in less than a year, he had 100%. He's a diabetic. He has severe atherosclerosis. It was discovered that he was having a stroke in February because his 3 fingers were becoming numb in his right side. And the 3 fingers were misdiagnosed as neuropathy. A week later, my dad's arm completely failed. And that arm falling was the center of attention to now rushing to the emergency room, where then the doctors were asking, when was his last stroke? He's never had a stroke. He's been having multiple strokes, very silent until they became symptomatic. How do you manage what are signs that are not there? How do you deal with teaching diabetics that the narrowing of your arteries is not just in your heart or on your neck, but that it's all over? My dad is slowly dying, and I don't have the heart to tell him, but he knows. One of the things that we're trying to manage is making sure that he's not demoralized. At this point, the doctor asked, when was the last MRA? How do you know that he has a severe atherosclerosis? I said, because we were in the hospital when he had the stroke. And I had to explain to his cardiologist that he has 100% blockage, but also blockage all over. And what I'm interested in is understanding how to give him palliative care when the time comes. Not every patient would have a daughter asking those questions. Who is the quarterback coming together with the medical team for the patient? And always ask the question, who is the quarterback of that professional medical team? Because the doctor didn't have access to the MRA. My parents never thought to talk to the cardiologist about how there was an MRA. It didn't dawn on my parents that he would not know. He's the doctor. Why would we have to tell him? And so at this point, we're managing what is the caretaking of a 72-year-old man and 12 medications my mom has to manage. My fear is not my dad, my fear is my mom. While she's taking care of him, is she remembered to take care of herself? She's like a rock. She's older than him. And she's the one who's bathing him, who's caring for him, who's managing his medication. Recently, the pharmacy changed what would be the strips and gave it to her because the pharmacist felt that she needed to save money. $15 for the glucose strips. What occurred was that the strips, she didn't realize, were not fitting the machine they have, which we had ordered by a nurse practitioner who came to visit my dad. And it was a glucose reading in Spanish. That particular strip is specific to that glucose reader. And the pharmacist did not have notation of that. And she felt that my mom was just pushing what would be a brand name. This is not about branding. So I had to intervene once again. I am the quarterback. Making sure that the pharmacist understood when she said, your mother likes, and I understand, she wants the brand name. I said, don't judge my mother. She was asking you for that specific brand because that is the reader in Spanish that she needs the strip for. And it's not covered by insurance, and money will not be an issue at this point. So do not try to save money at the cost of my father's health. He had not had his sugar level read, and sure enough, he had a 400, almost 500 reading level. These are the small examples of how the disruption of chaos can occur in fractions of a second. I could talk about my dad as your case study for a lifetime. But the Brooklyn Health Disparities Center is a partnership between SUNY Downstate Medical Center and the Arthur Ashe Institute for Urban Health and the Office of the Brooklyn Borough President. This is a unique community, academic, government partnership that promises to eliminate health disparities by bringing the assets of new and diverse partners to a strategic table focused on solutions. The health and well-being of our residents is a top priority and requires global competency. The overarching goal of the center is to eradicate health disparities plaguing minority communities in Brooklyn. The same communities for the last 50 years that have been plagued with the same issues. We must not be doing something right. And we have to figure out what can we change. I talk about how genealogy is becoming more and more a necessary tool to understand who we are and how health and environment and diet and inherited illnesses are causing a fast-paced deterioration amongst certain demographics. Diabetes is being studied because it's a fast-growing illness. But I found out that there's a study for diabetes that doesn't include Latinos, even though we're the highest amongst all groups. Because there's no funding for Latinos to be studied. And so how do you expect to address diabetes amongst the Latino demographic if we have no study funded for the Latino demographic? Inclusiveness in our health care studies is just as important as adhering to medical care. At Borough Hall, our agenda is to improve everyone's health and make greater strides in groups with the worst health outcomes. The Genome Center in Manhattan, the first in our city to be able to be dedicated. It costs $2,000 to get your DNA sequencing. Why are we not pushing for more of that to be happening here in Brooklyn? The cost of $2,000 stands in the way of us and greater knowledge. Us and greater knowledge, $2,000 per person. That's what it would cost. Where are the insurance companies here in this room, making sure that if they really wanted to reduce healthcare costs, they would have a study funded for this great volume of individuals in communities where the plaguing of obesity, cardiovascular, heart disease, you name it, we have it, right? And the zip codes are always the same. Where are the insurance companies trying to reduce those healthcare costs in these very zip codes by funding greater studies to understand the disparity and assist the Disparity Center? Keep in mind that all economic classes, racial groups, cultures, genders, and ages have a right to safe and healthy environments, but that is not always the case. We're striving for equity, and while we do so, we live in chaos. New York City prides itself on being a global pacesetter in improving the health of its residents. Prescription management is an important component to optimize their lifestyle with chronic conditions. I spoke to my dad's cardiologist to reduce medication from 12 to 6, because my point was, why do we need to demoralize my father taking 12 medications when we know he is not operable? And so we are managing half the medications he's been taking for the last 9 months. He's a happy-go-lucky guy. He left that center with a cane, wobbling, but he felt like he was the champion because he got what he wanted. He was tired of taking 12 medications, and it was making him feel depressed. The medication alone, managing so much, so many pills, was enough to demoralize the man I know has a lot of pride, and that pride is what's keeping him alive. Enduring inequities in health have their roots in persistent inequalities in wealth, housing, education, healthcare, and employment. Still, with our work here and our continued advocacy, will ensure that Brooklyn is a place where all people can thrive in healthy neighborhoods. We all strive to continue making our Brooklyn a better place to live, and therefore this state. It is a great honor to be your Brooklyn Deputy Borough President, and at this time I'd like to ask the Brooklyn Health Disparities Center to please accept these citations, proclamations from Borough President Adams commending the work. As I read, whereas it is a time-honored Brooklyn tradition to recognize those individuals and organizations that demonstrate an outstanding commitment to community well-being by providing encouragement and offering. Much, Doctor. Thank you very much. And support to local residents and those in need. It is therefore fitting that we join in acknowledgement of their special events and occasions. And whereas all of Brooklyn joins today to recognize and honor the Brooklyn Health Disparities Center for the outstanding contribution it has made in our communities. And whereas on behalf of all Brooklynites, I salute the Brooklyn Health Disparities Center, a novel partnership formed in 2004 between SUNY Downstate Medical Center, the Arthur Ashe Institute for Urban Health, and the Office of the Brooklyn Borough President, that is committed to reducing health disparities in Brooklyn and increasing the level of engagement of academics, community members, and policymakers in the process. I applaud the Brooklyn Health Disparities Center for fostering community-engaged research that contributes to the elimination of racial, ethnic health disparities in our borough, and for the dissemination of information regarding evidence-based health findings among academic, community, and policy stakeholders. I commend the Brooklyn Health Disparities Center for its devotion to ensuring that our communities thrive and for having a positive impact on the lives of others. And I thank everyone for all that they have done to touch and improve the lives of many, helping to move our communities forward as one Brooklyn. Now, therefore, Eric L. Adams, President of the Brooklyn Borough, do hereby confer the citation on Brooklyn Health Disparities Center and all of you here today. Thank you, SUNY Downstate. To you. And I want to end just by saying, I asked my dad, after a long week of work, 12-hour days, 7 days straight, for 2 weeks, how did you do it? You worked 12 hours a day every day as a livery driver. And I don't understand how you managed. He said, look at me here. He was lying down on the bed with a right side paralysis. It was enough for me to understand I cannot live that life the same way because my health risks are higher, knowing what he has gone through. Take care of yourselves, Brooklyn. Thank you.